Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors are of different types. First, mechanism of action of carbonic anhydrase inhibitors. So these carbonic anhydrase inhibitors will inhibit actually the enzyme which is carbonic anhydrase. So when it inhibits the enzyme carbonic anhydrase, this carbonic anhydrase actually, so this is the enzyme here. This is the tubule, this is the blood, this is the renal epithelial cell. So carbonic anhydrase is present in proximal convoluted tubule. Actually, this carbonic anhydrase will convert the water and carbon dioxide to H2CO3. This H2CO3 gets converted to H plus and HCO3 minus in the proximal convoluted tubule. This H plus and HCO3 minus is reabsorbed, whereas this H plus enters the urine. In the urine already chlorine is present. With this exchange of H plus, sodium will be absorbed. With this exchange of H plus, the sodium will be absorbed. Now this H plus will again combine with bicarbonate present in the urine, forming carbonic acid, which again in the presence of carbonic anhydrase forms water and carbon dioxide, which can be absorbed into the proximal convoluted tubule by diffusion. But here the problem is these carbonic anhydrase inhibitors will inhibit this carbonic anhydrase. So when they inhibit this carbonic anhydrase, so this will whenever they inhibit this carbonic anhydrase, so thus this carbonic acid cannot be converted to water and carbon dioxide, so there will be excess of sodium bicarbonate and what H plus are present. So these excess of sodium bicarbonate H plus in the urine are lost in the urine. So this will cause loss of sodium bicarbonate and H plus. So it reduces the reabsorption of bicarbonate and causes the loss of bicarbonate in the urine primarily. Because there is loss of sodium and bicarbonate primarily, so as a result this causes metabolic acidosis. So this will mainly inhibit the carbonic anhydrase. This will mechanism of action, it inhibits the carbonic anhydrase and thus it prevents the dehydration of carbonic acid to carbon dioxide and water. So this is seen in the proximal convoluted tubule, and as a result this bicarbonate ion which is present in the carbonic acid, this will is lost. So as a result it reduces the reabsorption of bicarbonate into the blood, and as a result it causes number one, chlorine has no effect here, only the sodium. So there is hyponatremic because sodium is lost. Okay, there is metabolic acidosis is seen because the bicarbonate is lost in carbonic anhydrase. Because there is metabolic acidosis, obviously there is decrease in pH is seen, and it also reduces the intraocular pressure also. Then clinical applications. The clinical applications are it causes glaucoma. It can be used in glaucoma uses. Clinical applications are actually uses. Uses of these carbonic anhydrase are it can be used in conditions like glaucoma, mountain sickness. We can use these carbonic anhydrase, or in edema with alkalosis. If a patient presents with edema with metabolic alkalosis, then carbonic anhydrase inhibitors can be given. Then then we have to see the side effects of carbonic anhydrase inhibitors are it causes metabolic acidosis, it causes hypokalemia because of the loss of potassium, and this hypokalemia is maximally seen here. Then it can cause renal stones. As side effect, it can result in hyperammonemia is seen especially in cirrhotic patients or in liver failure patients. These are associated with hyperammonemia. Then pharmacokinetics. So pharmacokinetics are these carbonic anhydrase inhibitors are well absorbed orally. They have the half life of these carbonic anhydrase inhibitors, especially acetazolamide is a carbonic anhydrase inhibitor with half life of 1 hour. Then we have dorzolamide is a special type of carbonic anhydrase inhibitor which is used in glaucoma. These carbonic anhydrase inhibitors are metabolized in the liver and they are eliminated by the tubular secretions. They are metabolized in the liver and eliminated by the tubular secretions. And the uses are already they are used for mountain sickness. They can be used for glaucoma and edema with alkalosis. But what about the main important prototype of this carbonic anhydrase inhibitors are acetazolamide. So we will see the uses of acetazolamide. Acetazolamide can be used in mountain sickness, especially in the mountain sickness. It is used as a prophylaxis in the mountain sickness. But if you were asked what is the drug used in acute, sorry, not acute, high altitude pulmonary edema. In high altitude pulmonary edema, we will use mainly the furosemide, whereas in high altitude cerebral edema, in high altitude cerebral edema, we can use oxygen. But for mountain sickness has prophylaxis, we use the acetazolamide. Then other uses of acetazolamide is acetazolamide can be used for periodic familial periodic paralysis. It can be used for cystinuria. It can be used for uric acid stones, and also we can use it for acute narrow angled glaucoma. Also we can use this acetazolamide. So these carbonic anhydrase inhibitors are actually contraindicated in the presence of liver cirrhosis. Okay, they have these carbonic anhydrase inhibitors mainly have a self-limiting action. They can stop on their own also. Then some important miscellaneous points of carbonic anhydrase inhibitors based on the drugs are uh, carbonic anhydrase inhibitors are actually carbonic anhydrase inhibitors are non-competitive blockers, but these are actually they are non-competitive and reversible blockade is seen.
Thank you and thank you for watching.